Come with me to a wisdom teeth consultation as someone with complex medical needs. Now, this was an incredibly jarring appointment, I unfortunately will say. I have quite honestly never met a doctor like this in my life in not a very good way. Oh, my mom just got hand surgery, so there's her cute little hand and bruise. But although the doctor was honestly kind of a wacko, he's going to be taking my wisdom teeth out next week. Oh, there's all my teeth. Very cute, very nice. That was honestly one of the most fuck-ass doctors I've ever seen. Appointment started off pretty good. We talked about my Ehlers-Danlos syndrome, why I have the medical devices that I have. And he started going on to, okay, so I give a medication called remifentanil, blah, 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 blah. Okay, so that's what I wanted to talk to you about. He pretty much immediately was like, no, that's what I do. That flat out. I told him I'm very sensitive to medications. I don't do well with fentanyl awake because he hadn't told me he was going to give me other meds. He escalated so fucking fast. It must have been triggering for him in some way. There must have been a patient that he had some issue with, which he did later on say that he's had some little wacko patients with this stuff, and he's like, no, I'm the doctor. I say what we're gonna do. So he escalated fast as fuck. He's going on and on, like damn near yelling at me. He already started out loud, got even louder, yelling at me about the fact that he's the doctor. He has 20 years of experience. He went through the anesthesia training. The patients don't know. They didn't go through the training. They're not the doctor. He's the doctor, and what he says goes. Mind you, rambling about this for a good 5 minutes, and I kept trying to interject at little spots. I was like, are you willing to hear me about my experience with these things? And he was like, yeah. Then while I'm trying to explain my experience, he's interrupting me 1,010 times. Telling me he's not going to argue with me for an hour about this. I wasn't arguing. My mom agrees. I wasn't arguing. I did a damn good job staying calm throughout all of it, whatever bullshit storm happened. He probably saw me giving my mom these very blatant looks of what is going on. He eventually told me he also gives propofol, Versed, ketamine, and Decadron. I do fine with all of those. But then he explained to me the difference between remifentanil and fentanyl and how it's supposed to be better. And I said, okay, well that makes me honestly a little bit more nervous because I don't know how I do with remifentanil. I know how I do with fentanyl. I do well with it if I'm already asleep when I'm given it. I just can't be given it awake. But trying a new opiate that I've never had in a non-hospital setting, because it's a little surgery center, it's small. With how complex my health is, does not make me comfortable. He also swore up and down 100% sure that I've had remifentanil before. I know I haven't. Whatever. After like 7 minutes of him yelling about how he's the doctor and what he says is what they're gonna do and it's non-negotiable. Also, when he started really escalating, I stopped him real quick and I said, I hear you. I hear that you have the training and you have the 20 years of experience, but I have 21 years of experience in my body. My body is very sensitive. I know what it's like to live in my body. As much as you have the medical training, I live in my body and I know what my body can handle. He eventually said, okay, we'll just not give you the remifentanil, and then kept poking in at the fact that I'm gonna give you all of the other ones, though we have to do all of the other ones. That's fine. I said I do good with the other ones. That's not what I have an issue with. And this is the second oral surgeon I've seen, and so I kind of had to just like cut my losses and be like, okay, this doctor, he has a lot of actual medical experience instead of only like mouth experience. He did a lot of experience in general surgery. He's a DO as well as like whatever doctor in mouth surgery stuff, doctor in dentistry maybe. So he has a lot of direct medical field healthcare experience rather than only dentistry. The other doctor I had a consultation with doesn't even give propofol. He only does Twilight. He only does fentanyl and Versed. I am not about that. I will not do that. I either will be wide the fuck awake or I will be put all the way asleep. I do not do well with any sort of in between. Fentanyl awake makes me feel incredibly sick. Versed awake makes me feel fantastic. I laugh my ass off, but I won't stop talking. Before they give me the propofol, I'm yapping my ass off. And before an endoscopy, they're putting the whole thing in my mouth while I only have Versed in my system. I'm taking it out of my mouth so that I can tell them whatever my silly little Versed brain thinks I really need to tell them about. And I'm just so excited to tell them about everything. I'm very enthusiastic, but extremely non-cooperative. Whatever. It was an incredibly jarring appointment, and my mom and I after were in shock for like the whole 20-minute ride home. We're like, did that just happen? I wish you guys could have been there because all the details and all just the magnitude of where he was at was absolutely insane. But he's gonna take my wisdom teeth out next week, so lucky me.